So a while back, I did a reading on Brianna Battle, and I was talking about her having the twins, right? And also, there was a video that she did, right? And in this video, it was when she did her gender reveal. And in her gender reveal, a couple of people said that she was having twins, especially her father. Now, she was taking fertility drugs, okay, which I mentioned in my reading. Please go watch my readings because my readings be real detailed. Like, I knew that she was taking fertility drugs, okay. And then she came back and said that her father and her father's family, they carried twins. So I guess that's how she didn't want people at that time to know that she was taking fertility drugs to get pregnant, okay. All right. Maybe so people won't be like, oh, she trapped him. She was taking fertility drugs and this and that. All right. And then she also mentioned that Janelle has twins in his family. Well, that's not how it works. Okay. Y'all could do the research yourself, but a woman is the carrier of the gene. The father actually isn't. Okay. Is usually in the mother's side of the family that carries a gene for you to have twins, okay? And usually fraternal twins are born during fertility drug treatments because it increases the chances of you having multiple children. So like basically it's a higher chance of you having twins or multiple children. And these medications work by stimulating the release of eggs from your ovaries, which can lead to releasing one or more eggs from your ovaries during your menstrual cycle. So this increases, I said these increases. I'm thinking about all these daggone baby, but this increases your likelihood of conceiving twins and multiples. It is important to discuss any concerns with your doctors, especially when you're considering having fertility drugs, okay, because your chances are more higher, all right? So if you are on fertility drugs, I'm just using this video as to tell y'all, be careful because you will have twins, especially if it doesn't run in your family, okay? So be careful out there. But anyway, yeah, and usually it happens like when you like do the fertility drugs, that's usually when the fraternal twins come, okay? Um and not all the time, but it's a higher chance from the research that I did. I am actually going to probably look it up on my phone. I have my phone right here. But always discuss these things with your healthcare provider, who can provide more personalized information and guidance. I am actually taking up health and science now because I want to become a midwife. I also want to hire doulas, and I want to open up my own doctor's office to give birth. And I want to do it in a more natural, holistic way, as I am a spiritual healer. Okay. And yeah, so basically that's what I'm going to college for. And everyone knows that I'm already a retired cosmetologist, and I just want to switch my career because I always want to be a nurse or a veterinarian, okay? And I always want to be a doctor or a veterinarian. So, right now I'm just going to college to become a registered nurse. Currently I'm taking psychology and sociology this semester, all right? And I love animals too, so I wanted to be a veterinarian. I know that sometimes I just go off and talk, but I just want to talk about this because a lot of people were like basically saying like she trapped him or this and that, and he was saying that she trapped him or whatever the case is. Like, but if you really pay attention, y'all have to pay attention to words that people say in their videos. Like she said, oh, he told me to go do what I had to do. Or it was like something like, go get what you need from the doctor so we can have these babies, which she was talking about was fertility drugs, okay? And that helps you to conceive, all right? So I don't know if she was having problems or issues with conceiving, or he did, or whatever the case was on why they had to go to a fertility doctor. But yeah, that's more likely the case why she's having quote quote some people say she's not having twins because she's so small, right? And she is very small to be carrying twins. When I seen the video, it was very alarming when I heard just 6 pounds. I'm like, oh my, uh them babies can be very, very low and underweight, and I wish nothing bad on nobody's children. Trust me, I didn't even want to talk about this because kids, listen, I got kids, and kids ain't nothing to play about, okay? Listen, all right, but yeah, I would definitely be talking to my doctor all the time because, like, I don't know, like, some videos her stomach looks bigger, some videos her stomach looks smaller, so it's like, I don't know, like, and there are videos where people can use to enhance their stomach and make their stomach look bigger. I don't know if she's doing that to just so people won't talk about like low birth weight and stuff, but that happens a lot with babies and twins. Maybe one baby might be lower birth than the other, and I also seen that she mentions a lot about having these babies vaginally, okay? And most chances when having twins is 75% chance that you would have a C-section with having twins. Now, some doctors, if they feel like it's safe enough and they're not breached, the umbilical cord is not wrapped around the head, if most twins are high risk, okay? They don't feel like something is wrong with the child, she could possibly have a vaginal, but 75% of the chance it is going to be through C-section. Maybe she don't want a C-section because she don't want to mess up her body. And I was also thinking, why aren't you eating? Is it because you don't want to gain weight? You don't want your stomach to stretch? Like, I don't know. But majority of women that are pregnant with twins, like, they have really huge, huge stomachs. And like, one of my daughters had one child, right? And that one child was 10 pounds. Like, that baby was huge. And I'm like, geesh. Like, I'm just going to say, like, even with one child, your stomach can get huge, So it's like kind of alarming. And then my other friend, she was carrying twins, but one was a ghost twin, and the baby was not inside the sac. So she had two placentas, but the other baby vanished, a vanishing twin. That's what she had. So yeah. So I mean, she should prepare also to have a C-section. She keeps talking about vaginal, 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 but majority of the time, twins are born through C-section. Not saying that it cannot happen vaginal. So don't come on here trying to correct me or nothing like that, because I did not say that there isn't a chance for her to have them children vaginal. And then she mentioned the NICU. So with them saying that and her possibility, and yes, twins do usually come early between the 35th and the 36th week. I made a video about it and I was just all over the place. I was tired at night. But yeah, they can come at that time. But 36 weeks is considered 9 months, which people don't understand. And 40 weeks is considered 10 months, okay? So when a woman has a pregnancy, she has to go through she can go through all them weeks of that ninth month. So people think that a woman has a baby exactly at 9 months. No, some women can go beyond 9 months and have them at 10 months. And they usually induce you like 3 days over, but some people allow you to go an extra week. Okay. So with her not saying a due date, I don't understand why not. I mean, I do know that she said because twins are born early. Okay, that's all you have to say. Well, twins are usually born early. My due date, say the due date was March 30th. She could have been like, I'm supposed to have my kids on March 30th, but because my due date is set early and it's set for 35 weeks, I might have them on February 30th or a week before that, because she mentioned 35 weeks, which will be considered 8 months and 3 weeks, okay? Because 36 weeks will be 9 month mark, all right? It's when I start talking all this weeks and stuff, people get a little bit confused. So yeah, well, it's just a lot to this. Like, this saga is just like draining. It's like, oh my gosh. Like, I don't know why I made this video, but I just wanted to talk about the fraternal twins. And